The exact day of my stroke was Labor Day weekend, that Monday night. It happened in the middle of the night around 2 to 3:30 in the morning, so I woke up from a dead sleep. I woke up and I went into the bathroom and I washed my face, something that I rarely do in the middle of the night. So when my wife noticed that I was washing my face, she asked me if I was okay. My response was garbled because my speech was thrown off because of the stroke. She realized right away, because her dad had a stroke, that I was having a stroke. Thankfully, my wife called 911. She used our hardline phone, which she never does as well. We always use our cell phones. But when she called the 911 from the hardline phone, she kind of panicked and she passed out. I thought we were having carbon monoxide poisoning throughout the house, so I was getting my children out of the house and screaming and yelling. While that was happening, I guess because the 911 operator called our local police department, and they came to my door within 35 seconds trying to get into the house. When I came downstairs to open the door, they realized that there was a medical emergency was happening. They got me into an ambulance and had me in the ED within 10 minutes of the phone call. They brought me to Riverview Medical Center in Red Bank, which was a few miles from my house, and the staff were just outstanding. From the moment I got in, they put me into my own solitary room to make sure that they could diagnose the right diagnosis, and it went from there. Dr. Ree is my neurologist, and he administered a drug called TPA, which is a clot-busting drug that thankfully was administered within a 3-hour time period. Now, they weren't sure when my stroke happened, but Dr. Ree, through his experience and expertise, realized that this is a drug that was going to be very beneficial, and thankfully it was. I was in the hospital for a total of 7 days, so 4 to 5 days in the ICU and then 2 to 3 days in the stroke unit. So I was discharged, and then I would visit my cardiologist, my neurologist, and my internist almost every other day, making sure my blood levels were thinned out and that this episode couldn't happen again. I was then given a speech therapist to go to for 2 to 3 weeks, and as you can see, it's worked very well. And again, I can't thank these people enough for making sure my life is going to have a quality of life that I wanted to have going forward. I can't thank the people at Riverview enough. The nurses, the doctors, the janitorial staff, the people that are in the cafeteria, everybody was so wonderful.